Hello, class. It's Trish, and I've decided to do my final debate project on modern technology and the impact it has on doctors and medicine. Although my paper has many more ideas than this, I've decided to narrow it down to these three key ideas that have been introduced. The first one I'll discuss is sedasis. The second one is PCHR, which stands for Personally Controlled Health Records. And the last one is Watson and how IBM technology is teaming up with Memorial Sloan Kettering Hospital during its cancer trials. Sedasis is a machine that was created by Johnson and Johnson and was approved by the FDA for use in 2013. This machine is created to replace anesthesiologists in the operating room. For now, it's used mostly for colonoscopies and endoscopies. Colonoscopies are the most common medical procedures, with about 14 million being done annually. The screenings are often uncomfortable and sometimes painful, and most patients would prefer to be knocked out. In recent years, anesthesia has grown more common for these procedures. In 2009, an estimated 1.1 billion was spent on traditional anesthesia services for colonoscopies, according to some research studies. I know for some people it can be scary to think about a machine that is acting as an anesthesiologist. However, this machine can monitor your heart rate, oxygen levels in the blood, and your breathing. A lot of anesthesiologists have had an issue using this machine. Most hospitals that do use it have agreed to have an anesthesiologist or a nurse on call in case something happens with the machine. However, the benefits definitely outweigh the negatives when it comes to this. The average cost to use this machine is between $150 and $200, whereas having an anesthesiologist would cost approximately $2,000. Sedasis uses a different combination of drugs uh, that is preferred by most doctors as a sedative, and the number one drug that it usually uses is propofol. It's a powerful drug that works almost like flipping an on-off switch in patients. There's no hangover. Propofol's quick action is ideal for colonoscopies, which usually take 20 to 30 minutes to complete. Unfortunately, the drug's reputation did take a hit in 2009 after singer Michael Jackson overdosed on the drug at home and died. But when used properly, the drug is widely preferred by doctors as a sedative. And the people who had the opportunity to use this machine were asked about their experience after their procedure was done, and all of them said it was a positive experience and they weren't out of it. They didn't have that day long stupor as you would with regular anesthesia. So to me, it sounds like that this machine is definitely a winner and should be looked into being used more. Next, I'll be discussing PCHR, which are personally controlled health records. It's the new Web 2.0. Uh, these health records can remind patients to refill prescriptions or even to schedule annual doctor's visits. And the good thing about these health records is that it allows patients who have the same diagnosis to join chat rooms, and they can discuss their treatments or even the medications that they've been on and maybe some sort of side effects that they've been having that they can discuss with other people to see how they're doing on certain medications. But as with all new things, these PCHRs do have some downfalls. Patients may not be honest about certain symptoms that they've been having, or they could be not forthcoming with issues of alcohol abuse or substance abuse, or even some medications that they're on. And they also have the ability to lock their doctor out of their records, which could lead to a misdiagnosis, which in the long run would be detrimental to the patient. But one of the interesting things I found during my research is that San Francisco General Hospital issued 80 HIV patients iPads and gave them free internet access and access to the health records. Having access to these necessary records allowed patients to access laboratory results, medication lists, and links to information. Over 80% reported that the PCHR prepared them better for their visits and helped them to take better charge of their health care, which I think is the overall with this system. It allows patients to become informed. It allows them to control their diagnosis and to make informed decisions about their treatment. And lastly, I'm talking about Watson. Watson is IBM's technology, more or less a supercomputer. I know that we read about Watson earlier in the semester how it went on Jeopardy and wound up beating one of the top, or actually the two top contenders on Jeopardy. Now Sloan Kettering has actually offered to take on Watson and to tutor it, in a sense of words, when it comes to treating their cancer patients. Uh, Using Watson for massive amounts of information, it fills in for some human limitations. It says the studies show that humans are good at taking relatively limited list of possibilities and using that list, but far less adept at using huge volumes of information. And this is where Watson shines, taking a huge list of information and winnowing it down. And also with Watson is that there's no personal connection to the patient. I know that that doesn't sound ideal, but think about it. Sometimes doctors hone in on one or two key pieces of information and run with it. Watson will listen and take in everything that the patient has said and use several theories to come up with a diagnosis and even a treatment. To me, it kind of outweighs having a doctor hone in on one or two symptoms and going from there and getting a misdiagnosis. From all the research that I've done and talking about these three things, I would welcome any of these if I ever needed, God forbid, a serious diagnosis from Sloan Kettering or in the future a colonoscopy. I wouldn't mind being put out by a machine and waking up refreshed and not in a day-long stupor. So I hope you've enjoyed my presentation, and I look forward to your feedback and any questions. Thank you.